before this pandemic, so even before coronavirus, African Americans were experiencing lower rates of health insurance coverage, increased barriers to accessing healthcare, and worse health outcomes as compared to our white counterparts. Research shows that historic abuse and mistreatment of Black and Brown communities by the medical system and ongoing racism and discrimination drive disparities in health, contributing to lower quality of care, distrust of the health system, and stress and trauma. So I have just a couple slides that I'm going to share with you, and we're going to go through kind of what this means and how it's affecting our community. So the COVID-19 pandemic has drawn new attention and further compounded these existing disparities in health and healthcare. Since the pandemic hit the United States earlier this year, there's been a growing body of research that has consistently shown that people of color have borne disproportionate burden of COVID-19. That is including being at risk for exposure, experiencing higher rates of infection, hospitalization, and death. The first bullet point talks about that what that research has shown in the United States, and that as African Americans, we have been disproportionately or unequally affected. The other thing that I want us to understand is that there has been no research that has shown that there is evidence of a genetic or other biological factors that make us more susceptible, but there are multiple factors that I'm going to go over in our next slide that have been shown to increase African Americans' risk of severe illness with COVID. So although there are no specific genetic or biological factors, the next slide, here's where I'm going to talk about some of those factors that are definitely affecting our community. Now, social determinants of health. So what you see on this screen right now, in the center, SDOH, social determinants of health. Those are conditions in the environment in which people are born, where they live, where they learn, where they work, where they play, and where they worship that affect a wide range of health, functioning, and quality of life outcomes. So the first thing I want to talk about is racism or discrimination. Unfortunately, discrimination exists in systems that have been meant to protect the well-being or health of individuals. Examples of such systems include healthcare, housing, education, criminal justice, and finance. Now, discrimination, which also includes racism, can lead to chronic and toxic stress, and it definitely shapes social and economic factors that put people from certain racial and ethnic backgrounds at increased risk of COVID. The second is access to healthcare. So healthcare access and healthcare utilization has been definitely impacting African American communities, because we know that African Americans are likely to be more uninsured than our white counterparts. Also, healthcare access can be limited to many other factors such as transportation, so lack of transportation, childcare, the ability to take time off of work, communication barriers, and cultural differences between patients and their providers. And of course, we don't want to miss the fact that there have been those historical and current discrimination, that there has been cultural, historical, and current discrimination in healthcare. Therefore, we know that some African Americans are hesitant to seek care because they distrust the government and they distrust the healthcare systems, those very systems that are designed to help protect them. So the type of work you engage in, so your occupation, we know that African Americans are excessively represented in essential work settings. So one of the things that we heard throughout the pandemic is that essential workers are people who are having to go back to work because they have to, may not because they want to, but because they have to. So some of these settings are healthcare, factories, grocery stores, and public transportation. Some people who work in these settings have more chances to be exposed to COVID due to the fact that they have close contact with other people, meaning the public or other workers. And guess what? They don't have the ability to take off work because they can't afford to. Education. We preach education in our church. So education definitely leads to income and can definitely impact wealth gaps among different different ethnic groups. But also that goes back into the type of work that people may be eligible for. So inequities in access to high quality education can lead to lower high school completion, lower paying jobs, and less stable jobs. The other thing that I want to focus on is that people in these situations often cannot afford to miss work, even if they're sick, because they don't have enough money saved up for essential items like food and other important living needs. Dense living conditions. Some African Americans live in crowded conditions that make it challenging to follow the recommended guidelines. In some homes, there are multiple generations living in the same household. And then it makes it harder for you to socially distance. The other thing is that there are growing unemployment rates and people may be at further risk of eviction and homelessness, and that contributes to that shared housing. Underlying health conditions, diabetes, high blood pressure, obesity, and asthma have a higher prevalence in African Americans, and that puts them at more risk for obtaining COVID and having complications from COVID. Transportation, we talked about not having reliable transportation may mean that you're using public transportation. So you're engaging with people from various backgrounds. You don't know what their risks are. You don't know who they've been around. And last, but definitely not least, I want to definitely drive home the point that African Americans are greatly affected by public health emergencies. Let's not forget, of course, the current pandemic and of course, how African Americans were affected in in Hurricane Katrina. So what can we do? What can be done? So this slide focuses on large scale systems change. So the first point talks about continued data aggregation. So that's a lot, mouthful. What does that mean? Well, data related to COVID-19, including testing, hospitalizations, ICU admissions, and deaths are broken down by race and ethnicity at the local and national level. The hope is that having this data will continue to highlight areas of greatest need, and then we can continue to target our resources in those areas. Flexibility in the delivery of healthcare. Expansion of telehealth. Now, some of you may have been offered by your medical providers telehealth or virtual appointments, or kind of like what we're doing now, to make sure you stay safe, and that if you don't absolutely have to come into the office, the office of your healthcare workers stay safe as well. But we definitely want to make sure that there's further expansion of that so that people can get what they need in the privacy of their own home. Further economic stimulus. There definitely needs to be additional efforts for small businesses and individuals and communities that are affected the most. Culturally tailored messages. I definitely cannot drive this home enough. Public health concepts are not always readily understood by our community. So concepts such as what is social distancing? What is flattening the curve? What is self-quarantining? What is face masking? And how long should I wash my hands? And those types of things. And why do I need to wipe down my groceries? All of that needs to be presented in a way that our community is able to receive and understand and digest the information. And then the other thing that I want to talk about is partnerships with trusted communities. So the first is faith-based, kind of what we're doing now. Faith leaders and places of worship play a key role in providing support, information, and spiritual leadership in the Black communities. We know that our pastors and our churches are trusted messengers and influencers who often have a history of addressing health and mental health promotion. So places of worship are increasingly leveraging their technology through radio broadcasts and Zoom sermons, kind of what we're doing now. So we have to do more of that to make sure that our congregation stays informed and engaged. The second is community-based organizations. So these are ethnic and racially based community organizations that have an established track record in our communities, people who we trust because they have a broad reach and they can definitely deliver the messages that we need to our community. And then this was something that I thought was very, very pointed and poignant. Community first responders. In many Black communities, the first responders are not necessarily going to be the police or emergency medical personnel. Rather, they are extended family members, pastors, neighbors, and other community leaders. So it is definitely important to make sure that those individuals are well informed so that they can disseminate the appropriate information to our communities. Lastly, what can you do? Number one, please, please, please follow the guidelines. They talk about we shouldn't be traveling, we shouldn't be gathering. Make sure you are staying abreast and staying informed of what the guidelines are and what the symptoms are. So if you, just as a review, COVID symptoms, fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, nasal congestion or runny nose, nausea, vomiting, or diarrhea. I know that's a lot to remember, but here's the thing, just trust your body. Pay attention to your body. And when something's not right, seek care from your medical provider. This is extremely important. Make sure you establish or have a relationship with someone who is going to be your healthcare provider, but somebody that you trust and that you can contact for questions. And then last, but definitely not least, don't go out if you're sick. So I know that was a lot of information. I hope that it was broken down in a way that you're able to understand it. But there's so many factors that affect our health as African Americans. Many of the things that we've talked about when I've done other talks at church, but many of these things are new. So we want to make sure you understand what your risks are, what's going on behind the scenes, and definitely understanding what you can do to impact your health and the health of your families and the health of our community.
Thank you. Thank you. Thank you so much, Dr. Williams. We really appreciate that. And what we're going to do is we'll have persons to come towards the end where we'll take our Q&A. So if you all have any questions for Dr. Williams, please make a note of those and we'll try to catch you when you're on the line. But let's give her a hand for the awesome information she has shared with us. And for those of you who are just tuning in, this is Dr. Ronica V. Williams. She's the Chief Medical Officer at Milwaukee Health Services, Inc. And for those of you who are on the line, if you have family, you can let them know that it is on we're live right now on Facebook, as well as my personal YouTube page. It is just Dr. Richard D. Shaw on YouTube. They can search for it. So we're so grateful. So at this time, we're going to have Ms. Cheryl Dean to come and share with us from a psychological perspective. Cheryl received her master's and bachelor's of social work from the School of Social Welfare at the University of Wisconsin-Milwaukee. She's a clinical substance abuse counselor, independent clinical supervisor, and advanced practical social worker. She has a variety of professional experience in the human service field, including administrative, managerial, research, counseling, and case management areas. Her main area of practice have included working in the mental health, substance abuse disorder arena as a counselor, case manager, and supervisor. Ms. Dean is currently a psychotherapist and substance abuse counselor for Focus Family Services in Milwaukee and Lakeside Family Therapy Service in Racine, where she utilized a variety of interventions, including but not limited to cognitive behavior therapy, motivational interviewing, trauma-informed therapy, and solution-focused behavior therapy dependent upon client needs. Ms. Dean teaches relevant life skills such as coping, stress, parenting, self-regulation, and self-care. She accepts children, adolescents, teens, adults, singles, and couples. Ms. Dean is also an adjunct professor at Upper Iowa University teaching human resource classes. So if you all will, please join me as we welcome Ms. Cheryl Dean. And so, Sister Dean, at this time, we ask that you unmute your mic, and then I'm going to put you in the spotlight here. Let me pull this up. One moment. All right. So now we have you. Can you hear me?
Yes.
Great, great. Thank you and welcome. And so at this time, we'll turn it over to you.
Thank you for having me. Good afternoon. Good afternoon. As you know, with the COVID-19 pandemic, it has really put a lot of individuals in situations to where they are experiencing increased anxiety and depression. So as it rages on, the anxiety levels especially have really surged along with the virus. And with that, they've been experiencing such symptoms as difficulty sleeping or eating, increases in alcohol consumption, or substance abuse. If you think about it, when they decided which businesses were going to stay open and close, all the liquor stores stayed open. And that, for some reason, was used as a coping mechanism for individuals who were homeschooling their kids or either being at home. I'm not sure if that was a good idea, but that's what happened. And because there's a lot of worry and stress over this coronavirus. And as this pandemic wears on, ongoing and necessary public health measures expose many people to experiencing situations linked to poor mental health outcomes, such as isolation and job loss. Because as you know, a lot of people end up with unemployment and not have enough income during this time. So the stress level is heightened because they don't have enough finances to meet their needs. There's also fear, worry, and stress, which are perceived as real threats. And people really don't understand when they're under stress and anxiety from certain things. So you want to take cues from your body, as to how you would feel if you're under stress or anxiety. And some of that would be headaches, heart palpitations, sweating, trouble sleeping, not being able to eat, and now in trouble falling asleep and staying asleep. But it's normal and understandable that people are experiencing fear in context of this pandemic. Because a lot of individuals are afraid because they don't know, because as Veronica said, there's not enough information about it. So they think they can so people are really stressed out. I just really can't stress enough how stressed out individuals are, thinking that they can just get it. And you can, if you don't take precautions, even going to the store, or if you have to go to someone's house for some reason, which really is frowned upon. So added to that fear are the significant changes in daily life, such as we really can't go anywhere. Our movements are restricted in an effort to contain and slow down the spread. Also, working from home. I had to start working from home, which was a big change for me. So not only working from home, but again, temporary unemployment and homeschooling of children. A lot of parents were not really ready or equipped to homeschool their children, especially when they are not technology savvy and having to all of a sudden do this, along with lack of physical contact with other family members and friends and colleagues. And I'll tell you that I can only say for me, and I shared this with Pastor, working from home and doing all the work that I was doing really took a toll on me initially, because taking all the issues that I take in and not having a way to talk to anybody about it. So I had to figure out how I was going to actually get some of the stress off me from what I do every day. So we really want to look after our mental health as well as our physical health. When you talk about anxiety, there's a lot of individuals who are diagnosed with anxiety. So along with the pandemic, the anxiety has heightened, to where I have clients I talk to every week now just so they can talk, not because there's anything specific, but just so they can talk. And there's something going on now called pandemic fatigue. And pandemic fatigue means that we've been under isolation, having to lock down for so many months, and looking at going back into it again, maybe in January, that individuals, they're just tired of it, which is why you see individuals still going out to bars or still going out, because they're just tired of staying home, not realizing that when they go out, even with a mask, when you go out, you can still actually contract the virus. And for my clients that have contracted the virus and it has been really severe, now they are afraid to go to sleep. You're afraid to go into that room where they had to really recover because they were home, thinking that they were not going to make it. So it really has taken a psychological toll on them. There's also an elevated fear of dying. A lot of individuals, I had a client who thought, maybe it was a client, it was a student of mine, but she thought she was going to die, because of all that happened with her with the pandemic, and trying different medications to try to help you to cope with it. One of the important things with anxiety right now is to recognize that there is no such thing as having no fear. I think even underlying, everyone has a little bit of fear on if they are actually going to, contract the disease. And even when someone coughs, or you see, or if you're in public and you hear someone cough, you're looking right away thinking, is that what they have? So even with that, individuals have a fear that that can happen at any time. But how we respond to this is really how we're going to get through the crisis. So one of the ways of coping with anxiety, which is used quite often, is mindfulness, which is a meditation technique. And there's also, and actually you can find mindfulness on YouTube, which is why I refer a lot of people to go on YouTube and put in mindfulness, and you will have some mindfulness videos come up, along with guided meditation. And guided meditation is where you will sit down, close your eyes, and someone will actually talk you through relaxing. I mean, it could be laying on, they could say you're going to lay on the beach, they could say a lot of different things, but just to get you to relax. It's also important that you stay virtually connected, which is another thing Dr. Williams talked about, was being able to talk to friends, being able to attend church virtually, being able to attend Bible study virtually, so those type of things is very important to stay connected. And also to not always talk about the virus. When you're talking to individuals, that should not always be a topic of conversation. You want to talk about other things that are going on and possibly focus on positive things that's going on, or either other stories. And you also want to, as you would call, limit your media diet. Because a lot of people are just looking at the news, they're seeing all this negativity about the virus, and it's causing them to either have more anxiety or become more depressed. So maybe just look at the news like in the morning or maybe at night, but not if you're home, not to sit up all day and just watch the media, and to look for positive stories and not just the coronavirus updates. So you talk about depression and COVID-19, just as with anxiety, the fear and isolation can be very dangerous for those with depression, because without an outside influence to remind them of the good, they may focus solely on the bad. So as they're thinking about all this that's going on, they're sitting at home, they're looking at TV and thinking of all these negative things that are going on, puts them into a deeper depression. And I'll tell you that some people don't even know why they're depressed or why they have gone so deep into a depression. So then we talk about pandemic and pandemic fatigue and things that are going on, so they can realize that this is probably part of why they're going into a deeper depression at this time. So we want to talk about good things and healthy things. And also, you really want to have them to not neglect themselves at this time, because there is a growing sense of hopelessness about how we're going to get through this and when it's going to be over. So you really want to talk about some positive things. So what I do is I encourage them to get up, take a shower, get dressed, cook your meals, get online and talk to people that you know. You can even make virtual dates with other people you love. Because your mind could tell you, I don't feel like doing anything today. Because I hear that a lot. I just want to stay in bed and do nothing. But this will only make things work. So I always encourage people to get up, to shower, to get dressed. And then the next time I talk to them, I'm like, okay, did you do that? And I kind of talk them through it. So, and if you're feeling down, put on something funny and lighthearted. That's one of the things that I do. I watch Girls Trip like every week because sometimes it's funny. So I watch funny movies. I watch Annie because it's funny, because that will really pull you out and it'll make you laugh. One other thing is substance use disorder and COVID. A trigger for either drinking more substance or relapsing back into substance is being bored, loneliness, helplessness. So they don't have anything else to do, so then they'll just drink. Because drinking alcohol really is like a sedative, or marijuana is like a sedative. which will relax them. So they'll use those avenues to relax them versus natural ways. And then we talk about that also. And we talk about how to help them to battle those urges, and how to use what you call thought switching, or how to urge surf, so that they can get through that without actually, turning to alcohol. And one of the things that we encourage people to do, and I know that it's cold outside, I realize it's cold outside, is to get outside. Even if you have a balcony, go on your balcony. If you can walk on a block, get some fresh air, do those type of things, because that will give you energy. So, and that's probably just about it, unless anyone has any questions.
Okay, if you will, Sister Dean, thank you so much. We'll try to direct all of our questions at the end. So for those of you who may have some questions for Sister Dean, if you would just jot those down. Again, you can post those in the chat box, or you can send them to me via email. That's pastorrdshaw@gmail.com, and I'll try to retrieve those. And then there's a number that you can text your questions to, 414-395-0561. If not, we'll try to take calls from the Zoom meeting. So thank you so much, Sister Dean, for—
I just have one more thing to say.
Yes.
Unfortunately, to receive mental health services, an individual would need insurance. However, there are ways to get around that. If you can find an agency that will do a sliding fee scale, or that would offer a few services, I'm not going to say free of charge, but really at a minimal cost. Now, the agency that I work for, Milwaukee Focus Family Services, that's one agency that does that will offer mental health services if you don't have insurance at a reduced price, or will help you, assist you with getting some type of funding for those services.
Thank you so much. And for those who are just joining in, that was Ms. Cheryl Dean. She is a psychotherapist, and she has come to be with us today to address the impact of the COVID-19 pandemic on our community. When we say our community, we're speaking of the African American community. And before her, we had Dr. Veronica Williams, who brought us a medical perspective. So we're just going to ask everybody to give it up for both of you and for what you have shared with us on today. Let me see if I can switch your screen over now. All right, so I can see everyone. All right, so at this time, we're going to get ready to invite Attorney Roy Evans up. Now, those of you who registered, and there was no registration fee, we just wanted you to email us, and you should have received the bios on each of our presenters. So I am not going through all of them at this time, reading their bios entirely, but we have shortened some of them. And here's one, Attorney Evans, who has been serving for many, many years, the community. And I tell you, I don't think we had enough paper to share all the things that he's been involved in and the things that he's been doing. So I'm going to attempt to give an abbreviated form of presenting him. Roy Bradford Evans is a Milwaukee native and graduate of North Division High School, class of 1965. He resumed his full-time education at Mount St. Paul College, Dominican College, where he earned a Bachelor of Arts degree in secondary education. That's English K through 12. He furthered his education by earning a Master of Science degree in Educational Administration, Supervision and Instruction from the University of Wisconsin-Milwaukee Administrative Leadership Program. 1976, Roy continued his education pursuits by earning a law degree, a JD, from the University of Wisconsin-Madison Law School in 1979. He's a board member of the Northcott Neighborhood House, and most recently, president of the board of directors for repairs of the Breach Homeless Shelter. He is the former chair of the City of Milwaukee Board of Review, current chair of the City of Milwaukee Board of Zoning Appeals, and a member of the State Bar of Wisconsin Alternate Dispute Resolutions Board. He is a member of the North Division Alumni Board of Directors and a student conflict resolution coach. He recently confirmed 2018 to the Federal Defender Services of Wisconsin, Inc. Board of Directors. Attorney Evans is a solo practitioner with a focus on small business development, employment law, municipal law, and construction contracts. His law practices include a focus on probate law, mediation, alternate dispute resolution, and representing small and disadvantaged business entities. He enjoys traveling, reading, and golf. His wife, Georgia, who is a retired Milwaukee County psychiatric nurse, currently working as a health care consultant. They cherish 3 children and 4 grandchildren. And just a personal note about Attorney Evans. Attorney Evans is one who is a voice for social justice. He was there for my family during our time with the Noose out in Brookfield. He offered himself to come not just for our family, but all who were impacted by that, to make sure that the police department and the city of Brookfield did what they were supposed to do and not play down the noose that my son found. So at this time, we're going to ask you all to join me as we give Attorney Roy Bradford Evans a hand. Now, the reason why I thought Attorney Evans, yes, go ahead on and give him a hand. The reason why I think this is important is that oftentimes we overlook or we dodge the reality of death. And I'm not going to assume what he's going to talk about, but a lot of times we do not prepare. And the reality is that Black and brown people have been impacted more by COVID-19 and in terms of the death rate. So we just want him to come and present and talk to us from a legal perspective. So Attorney Evans, we're going to turn it over to you. At this time, I'm going to ask you to unmute your mic, sir, if you see where to do that. And then I'm going to, they have this thing on here that says spotlight. So I'm going to put you in the spotlight where we can see only you. But before we do that, let me admit a couple people in. And Attorney Evans, can you hear me?
I can hear you. Can you hear me?
Yes, sir. I can hear you. And I didn't mention too, some of the things that I could out. He's an athlete, just an all-rounded person. So welcome, Attorney Evans, and thank you so much for being here with us.
Thank you, Pastor Shaw. I wish I could take credit for all of that, but my grandmother gave me some marching orders when I was just a toddler. So I still try to do things that would make her proud and in her memory as someone who sacrificed for me and all of us. I'd like to give greetings to all of my colleagues on the board here who are also members of St. Matthew Church. This is an excellent project. And before I go into that, I'd just like to thank Pastor Shaw for taking time to put this together. This is really critical. I think we need to meet more often, and we need to share our thoughts. As human beings, that separates us from animals, being able to communicate with each other in order to resolve problems, in order to share, in order to encourage and do all those things that make our human existence relevant and important. And just one professional or personal note with regards to this situation and condition that we're in. I have lived in Milwaukee all my life. I tried to stay active in the community and involved. I deal with a lot of businesses. The church is a business. It's a nonprofit business, but it is in fact a business in many ways. And I just want to say that in talking to many pastors that I know and many church members, this pandemic is going to be the end for some churches. Unfortunately.
Yes.
And we need to understand that. But I'm really happy and feel very confident that St. Matthew has the history, and it has the involvement, and it has the support, and it has the leadership that I believe we're going to weather this storm, and we're going to come out stronger as a church. So I appreciate everybody's involvement. This is critical to that involvement because it's going to lay the foundation for who we are and what we do in the future. I'm just going to make some general comments about how the pandemic is impacting. I'm still a practicing attorney, notwithstanding many of the other things that I do in the community and as a service to some of the entities that I work with, like the city and the county and the state. But I think Cheryl and Veronica mentioned it, and I think it's critically important, our ability to connect with each other. We need to connect with each other as human beings. It's critically important. They talked about the mental health aspects of this pandemic, but it permeates throughout everything, including and especially the legal field. And it makes us think in different ways. It makes us act in different ways. It makes us react in different ways. There's a lot of anxieties right now. There's a lot of uncertainty. There's a lot of confusion. And when you're in those types of states, it's hard for you to make rational, logical decisions. And when you don't make those rational, logical decisions, you create problems. Not only for yourself, but for anybody who is associated with you. So I think it's important for us to talk about these things so that we can recognize problems before they begin. My grandmother always say, well, you know, it's too late when you got the elephant by the tail because you know what you're going to get in your face. It's better to get up on that elephant and ride it through the tough times, and it would take you safely to where you need to go. So I think preemptive, by recognizing situations and preparing for them, will take us a lot further. This COVID situation has been an earth-shattering, life-changing event. And all too often, and it really doesn't hit you until it becomes a life-ending event. I know I've lost, and we have lost, and I know many of you have lost numerous individuals who have been taken away because of this disease. And we're all forced to adjust to it. It is something that we have not had to deal with before, and you can see when we don't have leadership at the top to coordinate all of our thinking and our skills and our abilities and seeking the best way to handle and deal with situations, it can lead to chaos. And it's unfortunate that we have lost more people than we should have lost. And when we look at that, Cheryl and Veronica have mentioned it, we as African Americans catch the brunt of all the ills that go on in our society. The disparities create more problems for us. And it's like when the white community gets the flu, we get COVID. I mean, and it takes us out because of all of the underlying issues that go along with poverty and go along with the health disparities and the economic disparities and the education disparities and all the disparities that afflict us as African Americans. But again, hopefully coming out of this, we have learned something, we will learn something, and what we learn, we can put into some actions to help us to get beyond this chronic and continuing dwelling on the bottom of all those things that we have worked hard. My grandmother has worked hard. All of our ancestors have worked hard to give us a platform so that we can be proud and have some impact on our lives and on the lives of those that we are put on this earth to provide. And speaking of the law, having practiced law for the last 40 years, I see everything Every time I look at something, I look at it from a liability standpoint. What's going to happen if this goes wrong, and what's going to happen if that's not done right? And it's all, in my view, impacted by the law. I know I tease pastors sometimes about my membership as a member of the church, that the Bible dictates my spiritual life, but as an attorney licensed by the bar, the Wisconsin statutes is my legal Bible, because I have to go by those statutes and those laws that govern our lives. Anytime something comes up, I go to chapter and verse. I can't go in the classroom quoting Deuteronomy. I have to go into the classroom quoting the statute and the law. I have to provide the proof and the evidence and those types of things that allow for a judge or an arbitrator or a mediator or a panel to make a decision to provide me with what I need in the representation of my client. And I know we've all had a lot of opportunity being quarantined at home to watch too much television. In fact, we should do a lot more reading. I've purchased several books, including Barack's book and 250 years of poetry to give me some insight in order to do some writing myself. I mean, you have to go within to find those kinds of things that allow you. That's why these kind of things are important, because it inspires me, and I need inspiration. I need support. I need reinforcement to continue to do the things that I do, and to answer those questions as to why do I need to continue to do these kind of things. So I certainly appreciate my church and all of those who are involved in this process. And I know because of the political climate, and I'm not going to talk politics, we've got the sheriff online. He can talk all the politics he's want because he's an elected official. But I'm sure we have gotten a lot as of late, some recent themes of note, and law and order. We hear that all the time. The rule of law. Nobody is above the law. Those are some very important fundamental types of things that we need to understand, and we need to be able to adapt to our understanding and dealing with each other and dealing with the things that we need to help us accomplish what we're doing. And in fact, as you look at this, you know, just speaking of politics a little bit, what if we didn't have any laws? What if we were just a free-flowing society that everybody could do whatever they wanted, whenever they wanted, wherever they wanted? We would be in total chaos. So the laws are critically important, and no one is above the law to provide the law with a basis and mechanisms to give us some guidance and some parameters to work within, and also give us an opportunity when there are conflicts to have those conflicts resolved and remedied. I don't like getting into arguments with people. We can debate, but if you want to get an argument resolved, okay, sue me, and we can go and get a judge and a jury. You can provide your proof and your evidence, and we can get out of that argument mode with some finding of neutrality so that we can move forward. Arguments and debates are good, but sometimes we need to put them to a resolution or put them to a test so that our theories or our positions can either be supported and we can move forward, or it means that we need to get some more research in coming to a joint understanding as to how we need to move forward. Because in a free society, laws are imperative. And again, it's like, just think if we had no laws, just think if the sheriff was the only law we had. He could dictate our movements, dictate what we do, dictate why we do it, when we do it, and things like that. That's why in some countries, and we are slowly moving towards this is why there is so much litigation going on in order to preserve the laws that we have developed. And laws are like anything else. They are challengeable so that we can get a clear understanding of how they fit us and how they support us, or how we need to put them aside, because they do not, this pandemic is going to create the need for some new laws, because it's going to create some situations that we have not in the past had to deal with. But the law is always changing and it's always being challenged. That's why the courts have give us opportunities to challenge those laws so that we can get a broader understanding. We need laws in order for a democratic society to function. If we didn't have any laws, our democratic society couldn't function. We just couldn't. That's why I enjoy being an attorney, because it provides me with some parameters to look at, to help us resolve and understand problems and deal with issues that many people don't know, many people don't anticipate. But when something does come upon them, they need some counsel, they need some interpretation, and they need some comfort in knowing that they can get those issues resolved in a manner that's not going to cause them too much consternation and too many problems. One of the things I've found in practicing law, and I've written several articles on it, is that we should try to do things before the fact. Too many times as an attorney, I get telephone calls, and the calls are, this has happened, that's gone on, what do I do now? This is where we're at. And as I talk to people, I'm finding out that we could have avoided this if you would have had counsel in the beginning. So we need to be proactive in our understanding of what the laws are, what they do, how they function. That's why, as an educator myself as well, I try to do, and I go to a lot of schools trying to teach civic literacy. It's just amazing that people don't know what controls their life or what impacts their lives. The laws and the statutes and the ordinances and the codes that we have. Even the church, we are bound by canons. And canons are the Christian laws that govern the Christian church. And even the CME church has the Book of Discipline. Those are laws that provide us with the parameters as to how the CME church is to move forward. We need that. So when there are questions, we can go to the Book of Discipline to see if, which has been laid out for us, so that we can see if we are moving in the right direction as far as a business is concerned. Excuse me, somebody's calling with a question, I'm sure, and I'll get back to them when I get an opportunity. Like I said, laws are statutes, we have codes, we have amendments, we have common law. That's just common sense. You know, a lot of people, unfortunately, don't have common sense because of, again, a lot of underlying issues. People have not had the practical opportunity to have exposures to differing types of situations that allow them to become educated and understand what it is that they need to do when circumstances come to fruition. There's business law, and like I said before, the church is a business. It's a nonprofit business, but it's still a business. There's family law that deals with the family. There's probate, and I'm doing a lot of probate stuff now. People are calling me and says, well, Aunt Mildred is not here anymore. What do we do about her farm in Mississippi, or about her house on 5th Street, or about, these are the types of things we need to talk about early in order to prepare for these kind of situations, because they will, believe me, free advice, these kind of things are going to overtake us at some time, and we need to be prepared. We need to get our affairs in order before things happen. And it's difficult because people have anxieties about talking about death, anxieties about but we need to take inventory. We need to start practicing preventive medicine. And I'm sure the doctors would agree with that. It's a lot easier to deal with. And instead of somebody coming in and says, well, I've been having this pain for the last 6 months. And then you take a look and it's at a point where there's nothing you can do about it. So we need to talk about these things, especially probate. I'm getting a lot of people calling now about wills. And again, a will is your ability to move forward your desire after you're no longer here. It's, again, a concept that is hard to grasp, but it's a reality. It impacts us as African Americans because we don't do wills. And what happens is those things that we do accumulate get folded into a general pool, and it goes to other people. We don't pass it on as a basis or foundation to provide the support that our children need in order to move forward. A lot of times I watch white attorneys who handle estates for Black folks, and the white attorneys get all of the money from the estate, and the money goes to their children, who my clients' children will have to compete against, and that's really unfair. And all that is that we don't appreciate, we don't understand, and we don't take advantage of those things that we can understand and take advantage of. So we need to start talking about proactive kind of situations, especially during these particular kind of times, because regardless of whether we come up with a cure for this, a lot of people, too many people that we know are going to pass away from this. And if we haven't prepared ourselves to deal with the aftermath, meaning providing a foundation for those things that we have accumulated in our life and passing them on in a way that other generations are going to benefit from, we're going to lose it, and it's going to go back to someone else. And again, like I said, this COVID situation has compounded the racial inequities. Cheryl has talked about the mental health issues. You can see the reckless driving that is going on. That is dealing with a state of hopelessness, I believe. And I talked to a lot of district attorneys, a lot of city attorneys, a lot of other attorneys, judges. I have friends who are prosecutors, and we try to share what goes into a person's mind when they do these things. What is missing from allowing them to make better decisions in order to not wind up in a situation where now they have killed somebody or they have ruined somebody's life, including their own, and now they, for a brief minute of euphoria, they're doing the rest of their life in prison. What goes into these types of things? And again, the COVID is not helping. It is not helping us because, again, we suffer more underlying problems than anybody else. And when you add, and I live across the street from a store, and I could see all the blunt wrappers on the street and the beer cans that get thrown onto, that I pick up every day, I see the increase in the need for people to do these types of things. And when you're out driving around feeling hopeless, you take your life into your own hands, not really understanding the consequences of your actions. So I'm just going to summarize and answer any questions that might be available on the tail end of this, is that there are a great many legal challenges because everything is legal. It's either legal or illegal. And everything is legal. Everything is impacted by the legal system. And again, you can see the Constitution, everything I do as an attorney emanates and starts with the Constitution, which I have to understand, appreciate, and interpret in a manner that was meant to provide us with the parameters and laws that we have today in order for us to continue to be and have an orderly society. There's a lot of uncertainty. There's a lot of anxiety. There's a lot of confusion. There's a lot of fear. And when those things take over your life, chaos is the only thing that can follow. So I encourage us to continue to have these types of conversations so that we as the professionals, we as people of knowledge and experience can share that knowledge and experience from different perspectives so we can reinforce each other, and not only professionally, but personally, giving each other courage to do what we're doing, because a lot of times we're not immune from all of the things that we normally talk about, like anxiety and like anxiety and fear and those types of things. So I think it's important for us to reinforce each other. And this platform is an excellent platform. And again, I appreciate Dr. Shaw for putting this together.
Thank you. Thank you.
I'm very proud to be a part of it.
Yes, sir. Thank you so much, Attorney Evans. And what we're going to do, and let's give Attorney Evans a hand. And what we're going to do is come back on some questions. We want to make sure that we get Sheriff Lucas in on his time, and then we will come back and have questions. But thank you so much. Thank you so much for that information. And I'm particularly concerned about people being prepared and accepting that death is a reality in some cases, and making those necessary preparations so that they won't be fighting over who's in charge in the end. So, Sheriff.
Chaos and death.
Yes, sir. So, Sheriff Lucas, we are going to bring you in now. Let me get my screen up, and then we thank you for sharing with us. Let me get everything situated here. Move spotlight. All right. Can you hear me, Sheriff Lucas?
Yes, sir. I can hear you.
All right. Let me do a brief introduction. I had to chip away at a little of some of yours too to get it in, and then we want to hear from you. And what we'll do is probably just go ahead on and take questions for you right after you're done, just in case if you have to leave. Okay. All right.
Good.
Okay. You good? Okay.
I'm good, sir.
All right. Thank you. Sheriff Arnell R. Lucas is the 65th Sheriff of Milwaukee County, elected on November the 6th, 2018, with the goal of restoring honor, integrity, and trust to the Sheriff's Office by treating everyone with dignity and respect. Sheriff Lucas commands a staff that is responsible for safety and security in Milwaukee, at the Milwaukee Mitchell International Airport, the Milwaukee County Circuit Courts, the Milwaukee County Jail, and the Milwaukee County Parks and Freeway Systems. Sheriff Lucas was born in Milwaukee's Hillside Terrace housing project and raised by his grandmother, who moved from Alabama to raise him and two brothers upon the death of their mother. He attended Milwaukee Public Schools, graduating from Rufus King High School. He has a bachelor's degree and graduated cum laude in criminology and law studies from Marquette University. And let me move this up a little bit. Sheriff Lucas chose a career in law enforcement at an early age after an encounter with a police officer, which showed him the awesome authority that officer holds. He was appointed a police aide with the Milwaukee Police Department in October 1976. In a career spanning over 25 years, he served as the Department Public Information Officer and as a district commander. He retired at the rank of captain. Sheriff Lucas still bears the scars of sustaining a gunshot blast to the right side of his face as a young officer. Sheriff Lucas was appointed Major League Baseball Supervisor of Security for Commissioner Allen H. Bud Selli. I probably mispronounced that, in 2002. Quickly climbing the ranks, he became Major League Baseball's head of security in 2007. He later served as chief liaison of Security and Investigations for the National Association of Professional Baseball League. Sheriff Lucas and his wife resides in Milwaukee and attends St. Matthew-Milwaukee Church, where he has been an active member for over 50 years. So St. Matthew, let us welcome our own Sheriff Lucas, as we have welcomed the rest of our own by giving them a hand, and we thank you. And so Sheriff Lucas, we will turn it over to you at this time. Thank you.
Thank you, Pastor Shaw and First Lady Shaw in her absence, to my fine churchmates, Dr. Williams and Professor Dean and Attorney Williams. Say thank you for allowing me to be on this panel. To all our members and friends that are on this call today, let me say thank you. And in the words of the esteemed gentlewoman from the state of California, I'm going to reclaim my time, but only for a few minutes, just so I can share a few words. If I were to go with the adage of no news is good news, then I wouldn't say anything. Therefore, having been asked to speak, much of what I'm going to say is not necessarily encouraging news. As to the COVID and its impact on our community, we have now been in this agency since December of last year, when a young man in my staff came to me and approached me and said, Sheriff, there's this flu, bug, virus, whatever you want to call it, that's spreading throughout China. And if it were to come here to the U.S., I want to present on the idea of preparedness. And I kind of laughed at the young man, thinking that there's a lot of various diseases that are in other parts of the world, but not here in the U.S. But I did allow him to make the presentation to my command staff in late December, and all of them received it with, didn't think much of it. But when we returned back from the holiday break, we got here and found that the virus had made its way to the state of Washington, and started to see some outbreaks in the city and state of New York and in New Orleans. And we knew then that there was the potential for an outbreak here in Wisconsin and all across the country. We've now been in the throes of COVID for well over 10 months here. And I'm fortunate to say that in many respects, the Milwaukee County Sheriff's Office and Milwaukee County as a whole has managed and navigated the COVID fairly well, with the assistance of the CARES Act, where federal monies were provided to government agencies. We've been able to deliver a level of service to our community that is respectful of all people. But where we have seen impacts in our community is with the rate of violence and trauma in our community. One, just read the newspaper or look at television, and each night you're seeing a homicide and or some type of fatal crash. And unfortunately for Milwaukee, we have already set all-time highs in the area of homicides, where Milwaukee's record was 165 back in 1991, of which 17 of those were attributed to one individual. We've seen a record number of overdoses. Last year, we set the record of 418. We've already surpassed that here in 2020. And before the end of the year, we could top out close to 450 almost or more. We've seen a increase in the number of vehicle fatalities. Again, it's unfortunate that individuals drive in the manner in which they do here in our community, resulting in fatalities. And then the one area where we will not, unless we just have an increase over the last 20 some days of this month, where we will not set a record is suicides. However, the suicide rate is alarming. It's going to be the second highest. 2017, there was 156 suicides in Milwaukee. We, at the pace we've been going, might top out around 130 here. And it's even more disconcerting that the number of suicides are people of color, which is not something known in our community. But let me say this, as it relates to the COVID and its connection to violence in our community. Unless and until scientists have an opportunity to correlate the increase in spikes in violence all across the country with the COVID, I'm not one that is going to readily say that what we've seen here in our community is attributed to the COVID. When you think about it, in early February, an individual choked the life of his daughter's mother and his two daughters, rolled them up in a carpet, put them in a garage, and set the garage on fire. We had earlier this year an individual, I believe in April, going to a home and take the life of 5 members of his family, including 2 of his own children. We also had an individual just a month or so ago in broad daylight, directly across the street from a police station on 69th and Silver Spring, shoot his sister to death, a woman who was a member of the clergy. And then just over the weekend, all of us heard the news of a 17-year-old who unfortunately was shot by a person known to her to be her boyfriend. All of these acts, while there may be pressures and stresses that could be attributed to COVID, I can't say that those acts were directly a result of COVID. And so we ought to be careful. I attribute what we see in our community to this high rate of immortality is leading to this high rate of mortality that we're seeing in our community. So again, what makes an individual drive a car at 100 miles an hour down a city street? It's got to be something wrong with him or her. What makes an individual shoot indiscriminately into a home and shoot someone? It's got to be something that's touched that individual. And so we've got to be careful as it relates to attaching everything to the COVID. Let me say we've done things to ensure that those loved ones that we have that come into my custody are treated with the utmost dignity and respect. Since the COVID, we've reduced the population in our jail. We've gotten our jail down to roughly about 670 or so persons in our care in single cells. Everyone is provided a mask and PPE. They have very limited opportunities to interact. Everyone in a pod stays with everyone in a pod. And then those individuals that are either coming into custody or either develop the virus are either isolated or quarantined, depending on the severity of their condition. In our courts have been impacted by the COVID. We've seen courts shut down in early March and just resumed here in the past couple of months. That's created a number of backlogs in our county where, again, those persons seeking justice cannot find it because, again, the courts have been shut down. So individuals who are likely to be convicted and serve a sentence are free and on the street until such time as they can be seen and heard in a court of law. And we've also had to, in our delivery of services to our community, be very careful and cautious of how we interact with our community. But I'm very fortunate that since the COVID, we've had very few number of positives on our staff and in our jail. And I'm also fortunate that the number of staff having be required to quarantine and or to isolate has been low. And I attribute it to the level of commitment, dedication that those individuals have to this service. So we should all be very grateful for that. The good news, if there could be any, is that as a result of the COVID, we can probably point to the fact that the number of infant deaths are down. Maybe it's because there are more adults in the home and less infants being moved around to either daycares or in other situations where they're put in danger. Also, the agencies that provide services, whether it's Sojourner Family Peace Center, whether it's the Alma House and others, are finding creative ways like virtual ways to deliver services to members of our community in ways that we haven't had to do before. And then the courts have got to find a way to clear up that backlog that exists now of about 1,600 cases backed up in the court system. And we've got to find a way to ensure that justice is delivered, and at the same time that we can reduce that court load. Also, evictions. I know that's a topic in our community that people are concerned about. When the CDC came down with an order midway this year, it said that the individual could not be evicted if they had some type of medical cause or condition that they would have to properly document before a sheriff could serve a eviction. But they didn't put no mechanism in place to do that. What this sheriff's office did do was when we went to a home where there was someone home, we provided them with that form and gave them an opportunity to file that with the court and thereby stop the eviction. If there was not an individual in the home, we would leave a form, giving that individual an opportunity to, again, file that form with the court so that they could not be evicted. So that was how we responded in order to diminish the harmful effects of COVID and being evicted at this difficult time. As a whole, domestic violence is something that should be a concern of all of us. We've seen roughly about 21 domestic violence homicides in the city of Milwaukee and multiple non-fatal shootings stemming from domestic violence related incidents. And there are a host of other crimes out there that are not attributed to domestic violence that could very well be coded as such, but for a lack of prosecution or lack of witness testimony and the like, were not and have not been charged as such. We have a concern in our community for, again, the high amount of trauma, the high amount of violence and recklessness. And it's not going to be solved by simply just the appointment of one police chief. All of us have got to work together in this community to solve the issues that we currently face. Not one sheriff, not one police chief, not one pastor can solve all of our problems alone. Working together, we can solve all of our problems. I'm committed to it. I know many that I interact with on a daily basis are committed to it. And if we keep working together with the health community, with the education community, with the law, members of the court, judges and lawyers and the like, and certainly with the greater community at large, we can solve these difficult challenges that we face during this COVID. I'm encouraged. As long as we stay encouraged, like Dr. Williams said, we got to stay connected with one another. We've got to interact with one another, and hopefully we can find a way to keep our community safe. And with that, Pastor, I turn it back over to you, and thank you for allowing me to be here today.
Thank you. Thank you. Thank you, Sheriff Lucas, for being with us. And let's give him a hand for the information that he has shared with us. And I'm sure that there are going to be some questions. Let me get myself situated here, and then we will go into some questions that our attendees have presented to me. We'll go with those that have been presented first. And then if we have time, if time permits us to take some from the call, then we'll do that. Here's some questions that were sent in prior to today. We have been hearing, I know Dr. Williams had to step away due to
I'm here.
You're back? Okay, because quite a few of these questions are going to be for you. Okay. This one is, we have been hearing that there are less reports of child abuse since the virus. Is that because of fear of retaliation, that the abuser is not going to be taken out of the house? That goes not only child abuse, but in other areas of abuse, or people feeling trapped in these situations. So Sheriff Lucas, that may be one for you.
I'll defer to the sheriff first.
Okay.
I'm sorry, I'm still open. Thank you for that question. As I indicated, that we have seen that the number of child abuse cases have been down, and it could be for a very unfortunate reason. We know that a number of child abuse cases are uncovered when our children are either in school or go to a healthcare provider or elsewhere, and that adult notices something about the individual and reports it to law enforcement. But there has been a decrease of roughly about 15 to 20% month to month over the previous years. And again, it's very concerning and disconcerting. And hopefully it's not because there are more cases. And again, because the child is not out of the household, doesn't have the opportunity to report it. Hopefully maybe because there are more people just not resorting to abuse of their children, even during this difficult time of COVID.
Okay, thank you. Here's another question. It says, I heard a child psychologist say that children as young as 3 can display signs of depression related to the circumstances of social distancing and closure. What signs should we look for in children and teenagers? And what are some of the simple steps we can take to help and or prevent? This one was not designated to a particular person, but I would assume, Ms. Dean, that we would give you the opportunity to respond, and any other panelist who wants to chime in on that, who may have some expertise in that area.
Yeah. What I have been seeing, especially with those with the young ones, have been depressed, a change in their behavior. You know, so either behavior will change to being more aggressive, or they'll be a lot more subdued. But there's definitely a change in behavior. And also isolation. Sometimes you'll see them isolate more, or just quiet, not talking as much. Some of the signs that you can see with kids when it comes to the effects of COVID on them. So, but a child is not going to verbalize or not even recognize what's going on. So the parent has to really, really know or keep notes of their child to see if there's any changes in their behavior or how they act.
Okay, what are some changes we should look for? Is it like spending time by themselves if they were usually an outgoing person?
Yes,
Okay.
Isolation, lots of changes in behavior. To where I've gotten calls to where the kids have really, really just been aggressive, been talking back, you know,
Okay.
not wanting to do schoolwork, not wanting to do anything.
Okay.
You know, except they will increase playing games, like video games. And that's all that they'll do is play video games at home. So you really, really want to watch for some of those, or even some that are just even more clingy to their parents, to where they weren't clingy before, but now they're up under them all the time for fear maybe they won't be there.
Okay, thank you.
Some of the tips, though, you said, Pastor, the secondary part of that question was, what are some of the tips that can be done? The main thing is engaging our children. You know, many times with the remote learning, kids are in a different area of the house. So perhaps moving them closer to where you are, engaging them about their progress, monitoring their progress, and then outside of the schoolwork, creating family time, creating creative opportunities in the home to ensure that there is purposeful engagement, to make sure that they feel comfortable expressing some of those sentiments that Ms. Dean talked about, and then also they feel that level of connectedness that they may have missed because they are socially isolated from their schoolmates or other activities that they were unable to participate in.
Okay. Thank you.
Another thing that I have suggested is hobbies. Other activities that they can do, that they have a hobby, something that they like to do outside of the schoolwork. But Dr. Williams was right when you talk about having family time, watching movies together, just so they can really just stay connected to each other.
Okay, great. Here's another question. It says, I feel like people, including myself, have experienced increased stress during the pandemic. We have anxiety and fear that sometimes can be overwhelming and cause strong emotions like loss, loneliness, and anger. How do we function mentally with everything and everyone being bottled up and shut down? You all may have alluded to that, but if you could just kind of restate something on that.
I'll go first. making sure that it goes back to what Ms. Dean just said, engaging in different hobbies, finding creative outlets to ensure that those feelings that are bottled up have an appropriate and healthy outlet. Talking about things that may be bothering you. Again, African Americans don't historically seek mental health services, but if you're feeling that way, this would be a great time to seek counsel from a therapist. Like I mentioned in my presentation, you can actually do that through telehealth, which is through like a virtual visit. So you don't necessarily have to leave your home. But also even exercise. I know there was a question that in the chat about, wearing a mask during exercise. So I'll loop that in too. But exercising is a way to release those happy hormones so you feel better. Just making sure that you are safe in exercising. So one of the recommendations is, if you definitely always take your mask with you, you would need to wear your mask if you cannot guarantee that you're going to be 12 feet away from somebody, because the main thing we know that 6 feet is the recommended distance, but also you want to make sure that if you're not going to be in contact with someone, you can guarantee that by either the time of day that you're going, where you're going to choose to exercise, those types of things, then it would be okay to relax your mask. The other thing you want to be careful of, we talked about don't touch your face or, commonly use surfaces when you are exercising. Be careful of you're not, bending down to tie your shoe on a bench that people may touch or those types of things, because we often unconsciously touch our face, and that would be an inlet for the virus into our bodies. But exercising, seeking therapy if you're feeling like you're not able to manage some of those feelings that you're experiencing, talking and engaging with family through creative outlets. But all of those things can definitely help be creative outlets to some of those physical things that we're feeling, or the mental things that turn into those physical symptoms.
Great. Thank you. Let me do this. We've been on now for an hour and a half. Let me get through a couple more questions, and maybe whoever that was who was trying to speak can allude to something if you're answering another question. But just let me go through these right quick. Let's see. If a baby is an asymptomatic carrier, is the virus weaker than if an adult was the carrier?
Not necessarily. Okay. So there's not, that's the quickest answer, but the virus is the virus is the virus. So we know that, how extremes of age or certain populations that may be more detrimentally affected, but there's no indication that they're like the strength of the virus has been measured like in one patient versus the other. The other thing I'll just add, really with respect to it would be, when you're exposed to that baby or an adult, we know that the incubation period for COVID is 2 to 14 days. So that's why you've seen kind of the 14-day quarantine. But I know the CDC just came out with some additional guidance about quarantine. But the main thing is that with respect, if whoever is infected, if they're asymptomatic, meaning they don't have symptoms at all, or they're exhibiting symptoms, there's not really been a lot of data about their ability to infect someone else based on age.
Okay, thank you. Attorney Evans, I think this will be one for you. If someone has COVID and would like to set up a will or a trust, how long is that particular process? And if the person starts the process but falls into a state that he or she cannot consciously complete the process, what happens?
All right, thanks for that question. I do a seminar called You Can't Take It With You. And that is dealing with being prepared with all of the documents necessary to provide you with the support, transitional support that you need. If a person has COVID, you shouldn't have to have COVID in order to get a will or have a will. Everybody should have a will. That's critically important. But the question that you're alluding to is that, and I've done hundreds and hundreds of wills, and I've run across all kinds of situations where someone will call and say, my aunt is in the hospital, she has COVID, and she needs a will. The first thing I ask is she able to understand what she is signing and what she is willing over? And does she recognize what she is doing? If a person is in a state that they don't recognize what they're doing, then ethically and morally, I cannot go forward with preparing a will for that individual, because as part of the process, an individual has to swear that they are in full capacity of their understanding of what they're doing, because there are too many opportunities for people to persuade people or cajole people or threaten people and make them during a period of uncertainty turn their property over to them. So a person has to be of sound mind and fully aware of what they're signing and why they're signing it, or else I couldn't, in good conscience, have them do a will. But everybody should have a will regardless.
Okay. Thank you. And Attorney Evans, this one is directed to you. Let's see, what rights do we have in senior facilities that have decided not to impose restraints on visitors entering our facilities? No limits on number of visitors, including children. Once in the building, sometimes masks come off, pressured by some residents or visitors. Per CDC, this is not recommended.
Yeah,
was I clear on the question?
Well, it's more a general question because there's a conflict of rights. There's rules, there's laws, there are regulations, there's procedures, there's processes that are governed by the entity. And those entities have laws that they have to recognize also. And it's a conflict of rights. Again, you have in our divided government now, some people feel that masks are imposing a penalty on them and that it conflicts with their personal rights. And some people on the other side believe that it, by exercising that personal right, is putting those who do believe that masks and understand that masks are important at jeopardy. So it all depends on the entity, what their rules are, what their regulations are, and most critically, law is not a law or rule is not a rule if you don't enforce it. First of all, there has to be rules, there have to be policies, and then there have to be procedures, and those procedures have to be followed. If not, the reason you have rules and laws is to protect yourself from liability. If those laws are not adhered to and something should happen, then those not enforcing the laws are liable for any consequences that may be derived therefrom.
Okay. All right. Here's a question from a different individual, but Attorney Evans is directed to you. If someone thinks they contracted COVID on the job, can they collect unemployment for the time that they couldn't work?
Well, that's probably not a legal question. That is a question, again, of policy and procedures. If a person is an employee and they contract COVID at work, then the work has unemployment compensation that they pay into that provides their employees with compensation if there is in fact some type of injury while on the job. So a person could and should apply, but again, they have to prove and show that COVID was contracted at work in order to give them some basis for receiving unemployment. Some people normally when you apply for unemployment, if you've ever applied, they deny you and put the burden on you to prove that you were infected by someone in your workplace. So unemployment is available. Whether it would be granted without a hearing is one thing, but you cannot be denied from applying for unemployment because you contracted COVID through an employment.
Okay, Thank you,
Shaw,
sir.
if I could expound on that, because I experienced it, it would be under the fair labor standards and workman's compensation. If an individual contracts the virus in his or her employment, then he or she could receive workers' comp for the period. And then, of course, there's the 14-day or 10-day period. And then you would retest. And once you clear, you'd be eligible to return for work. It's those instances where an employee is not able to demonstrate that he or she contracted the virus while at work, where then it becomes a little trickier, where you then have the county did set up a bank of time called, for the sake of this conversation, special leave time, SPL time. And if an individual say go travel with family, comes back, has the virus, now he or she, or if there's a need to quarantine, they have that bank that the county has provided. But once that bank is exhausted, now you have to use whatever personal time, vacation and or other time, in order to continue to receive payment or compensation during that period. So it's a matter of whether, again, you're able to prove or show, and then it's a workers' comp issue. And if not, then it depends on employer to employer.
A quick editorial note. This is why the stimulus has been held up, because of the demand that employee liability be placed into the stimulus bill, removing employers from liability for the consequences of their employees catching COVID on the job. So it is a big deal, because in many of the meat packing factories and a lot of the other situations where there have been numerous people that have contracted COVID, this could prove to be a big problem for some of the large factories that allowed this to happen.
Okay. Thank both of you. I'm going to present one more question, and then for time's sake, for the panelists, if any of you have to get off, we will get off. I don't want to hold you any more than about 3 minutes. So that may take all the time for this last one. But it's to me, it was an important one, because we all go shopping, we go grocery shopping. And but the question is, and it was directed to Dr. Williams, what is the best way to wash down groceries and other packages that we bring home? So I'll direct it to Dr. Williams first, and if there's anyone else who may want to hit on that. And before you answer, probably what we'll end up doing, I have the emails and the contact information for others who submitted questions. If it's okay with the panelists, I may shoot you all those questions. And if you can respond via email, then I'll get them back to the individuals for the sake of time. Dr. Williams.
So typically, everything can't be wiped down per se. So dealing with things that are packaged, it's definitely appropriate to use kind of a disinfectant wipe to just kind of wipe over things that are packaged. So like if you had like rice or, things that are enclosed, definitely. With respect to produce, that's going to be a little bit challenging. I know some people may, there's special, even with fruit, there's like a fruit wash that you can wash your produce with. That's prior to COVID, but you can, definitely rinse those, let them air dry, those types of things. But so really just your normal kind of, if you have Lysol wipes or whatever, brand you have, you can definitely just do a quick, wipe down before you put those things in your cabinets. Sometimes some people with their mail, I'll just kind of branch into that as well. They'll leave it in the garage or let it sit, for, a few days before they opened it, or those types of things. So those are just minimal things that you can do to just kind of decrease, the exposure or things that may be on your, the things that may be on packages or mail or things that you're bringing into your home, just to make sure you are indeed trying to make sure you're safe as much as possible. But the main thing is going to be ultimately washing your hands, wiping down your surfaces, and making sure that, after you're touching things that other people may have touched, you're not touching your face, your eyes, your nose, those types of things. So even if you did not do any of what I told you, the main thing would be just to, from the standpoint of wiping things down, the main thing is washing your hands and and not touching your face will definitely decrease your risk of putting things that other people may have touched into your body.
Thank you. Thank you. Dr. Williams, Mrs. Dean, Attorney Evans, and Sheriff Lucas, I want to personally thank you for taking the time out today and sharing with us. And I'm just going to ask everyone to join us and give you all a hand for the information that you all have brought to us. I want to thank our audience, those of you who tuned in through Zoom. We have a few people who are watching via Facebook and YouTube. We want to thank you as well. I also want to give a special shout out to the office staff, Sharon and Lisa, who were getting the information out, getting these questions to me, and to communicating with our panelists. So we're going to end on that note. Thank you all so much. My plan is to have a part B to this. Hopefully we can look at how the pandemic has impacted our students in school, the educational system, and other things. So you all just listen out for more information on that. So at this time, we just pray that God's peace be with each of you. Thank you so much. God bless you. Have a good evening.
Thank you, Dr. Shaw.
Thank you. Bless you.
Thank you all.